Governor, I think a lot of businesses who are set to reopen in phase 2 were hoping for more specifics today, particularly salons. Can people do facials? Are they allowed to blow dry? Are you saying those guidelines are not going to be available until later in the week?
Are they not online now?
Not now.
When are the hairdressers going to be online? Okay, so, excuse me, a number of, as I said, we spent the weekend getting online as much as we could, and there is a lot online now for restaurants, houses of worship. We want to have one more town hall with the gyms. We want to get a little bit more feedback, so we're going to have one with the gyms, and give us like another day or two for the salons and the barbers.
You mentioned the gyms right there. Are you sure whether or not yet masks are going to be needed inside of a gym?
That's what they're figuring out. So, like, no, I am not sure. Some gym owners really want to do that. Others feel that they can do a good job keeping people sufficiently far apart. So what we're trying to do is like strike a balance between keeping everybody safe, but not giving businesses such a rigid set of rules that'll be hard for them to follow. So if I could just ask for another day or two, we'll have more details online.
And just following up with that, you mentioned that a lot of these decisions are made in coordination with our neighboring states when it comes to opening certain sectors. Do you know if Massachusetts or Connecticut can be opening their gyms anytime soon, based on your reopening?
I don't know where they are with gyms. It's funny, I spoke this morning with Governor Baker on various things. I think he said they're a couple weeks away from indoor dining. But I don't know where they are with gyms.
Governor, the lower case numbers over the past couple of days, does that surprise you given that we're now just a little over 2 weeks out from lifting the stay-at-home order? Would you have thought there would have been a spike since that was 2 weeks ago? What do the case numbers tell you? What are you seeing?
So let me say a few things. I'm very pleased with the numbers. I do want us to realize we tested 1,300 people yesterday. How many people? Roughly, less than 1,500 people. You know, during the week, last week, we were up to 3,000 a day. So it's excellent news. It's a plateau, but I don't think we should get too excited when we hear 70-something because we tested many fewer people. I feel good about it, right? Like, I'm really pleased that we reopened on May 8th, and now this is the data. This is data today and yesterday that we're observing, which is showing us if we were going to have a problem, because we started reopening 2 weeks ago, we would start to see that today, yesterday, the day before, today, and tomorrow, and we're not. So is that your question? So that's a really good thing.
If I could just follow up with Dr. Alexander Scott, could you just update us on the number of nursing home fatalities? And with these smaller case numbers, are you seeing any trends? I know I've asked this before about where they are. Are there pockets of cases? Is it certain kind of workers? Is it mostly healthcare workers? Can you just update us on the trends you're seeing?
Yes. Of the 13 fatalities we announced today, 5 were associated with long-term care facilities. Among our unfortunate deaths, through the end of last week, roughly 440 of our fatalities were associated with long-term care facilities, and roughly 20 have been associated with assisted living facilities. In terms of the data that we are seeing, we are really focusing on places where we may see a cluster and reacting quickly, particularly within our communities of color. We've talked about the fact that we have had a progressive, comprehensive response with congregate care settings, going in quickly, being able to address infection control concerns, make sure there's adequate PPE, get the testing done. We're continuing to do that across the board. So where we were seeing clusters earlier on in our manufacturing companies, we have not continued to see that because The public health measures that we've taken have been effective, ensuring effective infection control measures, making sure we identify people who may have been positive, get them isolated, and speak to their contacts and get them quarantined. We know that these measures work, so we're continuing to do that if we see a cluster within a housing development or a business, working very closely with employers, continue to encourage businesses to have their COVID-19 control plan. That's a way to really help employees and customers feel confident and feel safe knowing that those types of plans are in place and seeing that those types of plans are effective in helping to quell clusters of cases that exist. Does that answer your question?
Yeah, I guess among the positives, are you still seeing just a high percentage in some of the urban areas and some of those areas that you were seeing before? Have there been any other kind of sporadic things, or is it just kind of a random scattering of people all around?
No, we are definitely still focused on our higher density communities. Central Falls has 26% positive. Providence has 22% positive. North Providence has 18% positive. Pawtucket and Woonsocket both have 17% positive. That's our priority for really being aggressive and comprehensive and focusing on getting those percent positives down while we continue to expand testing and make sure we're capturing as much of those communities as we can.
Just to follow up on that, I believe the zip code data hasn't been updated since May 4th. Is that something that's just not being posted to the public-facing page? It's something you're still tracking, I assume?
It's definitely something we're tracking and working to update. As we were doing the data migration, we were bringing the data back slowly, starting with cities and towns and working to the zip codes.
Director Jones, I know over the weekend you had, I guess, an email that was sent out to some community groups expanding the Equity Council to include some additional members. We're hearing a lot right now, essentially two completely different narratives. In some sectors, there's this almost desire to pause reopening based particularly in the communities represented by the Equity Council. On the other hand, we've got people who are putting out jingles saying that we should be opening up, give us our summer back, and so on and so forth. How do we marry these two completely opposite narratives right now?
In my opinion, the way that we marry those two completely different narratives at times is to ensure that we have community at each and every table, in each and every forum, giving us insight and input on how best to do each opening phase. And with the Equity Council, we have that opportunity. As you mentioned, all of our communities of color are represented on that council, and it's an action-oriented, action-focused council, not one where we just sit and talk and we do nothing next, but it's action-oriented, and that action includes the community on each of those pieces of work.
Governor? Yeah, sure.
I want to answer that and tie in something Brian was asking about, because this is what's on my mind now. This is what we have to really keep our eye on, which is communities or settings where we are very definitely still not out of the woods. I mean, the CDC says you want to be at less than 10% positive. And we just heard that in certain areas of Providence, Central Falls, Woonsocket, North Providence, we're not there. We're at twice that. So if you were to say to me, you know, what am I worried about? We're spending an enormous amount of time right now getting the new rules and regulations out by sector. And I hear you, Kim, we've got to pick up the pace. But we're trying to get it right, talking to businesses. But then we have our eye on these communities where the positive rate is still stubbornly high, which means we have to do more testing. We need to get more folks to come out to test. We need to do a better job of educating, public education, and that's why the work Mom Ed is doing is so important. But someone asked this question, you know, I had a call Friday with faith-based leaders, and some of them were saying to me, Governor, we respect your decision to go to 25%, but we're just not ready. And I said, that's fine. You have to do what you think is right for your community. So if I were a pastor in Central Falls, or certain parts of Providence, or Woonsocket, or one of these communities that's deep, has high, I might think twice. And I might impose stricter regulations in light of what's going on in that community. You know, I think you see Newport now is thinking of doing their own ordinance to require people to wear masks. You know, I have to respect that. They must have reason to believe that in Newport, in the tourist season, there's going to be lots of people, out-of-towners, that's the way to go. So it's important because this is the way we're going to go for the next year. We're at a pretty stable place overall, but we will get into trouble if we don't keep our eye on communities where we think that we have issue. That has been the story of every country. They lose sight of a mini outbreak. And so that's what we're not going to let happen in Rhode Island. And we won't let it happen. That's why we have so much testing and so much contact tracing, and we have an equity council, because we want to, keep a lid on the virus everywhere.
Governor,
Sorry, I cut him off.
No, sorry, Governor, I'm hearing from teachers from all around the state that say they feel that as a reward for their hard work, innovation, and creativity in distance learning, that they're facing layoffs and program cuts, and even essential subjects like math and English are on the table in some communities.
Yeah.
So what do you say to them?
So I don't know which communities they're talking about. I'm not aware of that. I talk to the mayors often, and I don't know of anyone planning that. So here's what I would say. First of all, they deserve our gratitude. I mean, it's amazing what teachers have done. They've moved on a dime to embrace distance learning without ever having done it before. They're working harder than they were before, and they're doing a great job. So I want to be crystal clear about how grateful and impressed I am with educators. Look, here's the brutal reality. If we don't get further federal stimulus from Congress, I can't even imagine how horrible it's going to be to balance these budgets. And I have towed the line on furloughs as long as possible. As I've said, I've been crystal clear. I view these things to be last resorts. That's especially true for teachers. But if we don't get more money from Congress, everything's on the table. And now my view would be that's a last resort. But I want to be very clear with people. An $800 million deficit is like nothing the state's ever seen before. And the choices we'll have to make will just be unprecedented.
Also, are we going to hear more about rental assistance this week?
Yes. When? Tuesday? Or today's Tuesday? Wednesday or Thursday?
All right, thank you.
Governor, we saw the photo of you and the first gentleman experienced outside dining on Friday. Could you just take us through the experience? Did anything happen that maybe change your perspective or shape your perspective on it?
Thank you for asking. We had a great time. And I would encourage people to go out. If you're lucky enough to be able to afford going out for dinner, do it. It was great. It was, it's different. The waitress has a mask on. This particular restaurant did a really good job. There were signs everywhere around what is social distancing. Don't come in if you're sick. They figured out a way to have touchless ordering. I noticed the waitress, if patrons got up from their table to go to the restroom without their masks, the waitresses were very kindly and respectfully asking them, hey, could you please put your mask on? And people complied. So where we were, a lot of people were out. It was excellent, and frankly, it felt nice to kind of be normal again. So it was good.
You provide your information to the restaurant?
Yes, we did. We did, ahead of time. Yeah, we had to make the reservation.
How is that going with the state collecting the information?
Fine. Yeah, Pete, you want to say something? Yeah, people are complying.
It's a very helpful tool, as we know that having the information similar to the app, being able to talk about where you have been is helpful. What we are doing is only using the information for a brief period of time if your name is collected from going to a restaurant. I also went out with our family to enjoy dinner outside, provided our name and information, and it's something that we encourage to those who are able to do it.
Continue in phase 2, that you give your information?
Yes.
I did get an email from a mother, Dr. Scott, that the server now, her daughter, I guess, provided her cell phone, and now the server keeps texting her. They think they saw him drive by the house. There's some people that feel a security element of giving their address and phone number to a stranger.
I haven't heard that. That's certainly something we would want to be aware of and address in any situation, whether, where you're engaging in that type of information. I can be clear that the restaurant information that's held is kept secure, and certainly we want to work with the restaurant to help make sure that that's complied with and maintained from that standpoint.
Has the health department accessed or asked any restaurants for their information so far?
Only if there is a cluster of cases. I'm not, at this point, aware of any right now.
Governor, have you received any further guidance from the CDC on youth sports returning? Are you getting any closer to feeling more comfortable about them returning?
Thursday of this week, we're going to talk about youth sports. It's a big topic. It's, you see Major League Baseball hasn't even made their decisions. So, yeah, we're talking to the CDC, talking to other states, and on Thursday I'm going to have more to say about it.
Michael?
Governor, there have been reports that on a national basis, different places, different areas are experiencing a very different virus, that in rural areas out west, Midwest, and so on are seeing really half or even fewer per capita cases than the Northeast, especially in hot spots like New York or Boston. Do you see any political polarization similar to that within Rhode Island? Because we know that Central Falls has a very different experience of the virus. Pawtucket has a very different experience of the virus than, say, West Greenwich or Exeter. And even within zip codes, 02906 has a very different experience than 02909. And these are associated with population density, the types of jobs people hold, whether they can work from home, and so on. But this seems to me to raise the question of polarization between people who just sort of don't get each other's experience.
Yeah.
And what do you see as the threat from that, the risk from that, and what can you do?
So it's a complicated question. You bring up something which is real. To me, it goes to equity, which is why we have a whole work stream around equity and why Secretary Jones or someone on her team is in every one of our phone calls, like she says. Equity has to be at every table, the testing table, the contact tracing, public health, the economy, et cetera. It is an issue, right? Now, let me say a few things. The virus is everywhere. We've seen issues in Burrillville, in Smithfield. It's everywhere, which is to say those are suburbs or more or rural places. Having said that, it thrives in density. We know that. It thrives in density. Rhode Island is the most or second most densely populated state in the country. That makes this a lot harder. And the places you reference, Central Falls, 02909, these are densely populated areas. And so the experience you have in a densely populated part of Woonsocket or Providence is different than South County. Having said that, it's in everyone's interest to prevent outbreaks, to prevent a spread, and to prevent a resurgence. So just because you might live in a community which is less dense and less affected doesn't mean you can go out without your mask, doesn't mean you can break the rules, doesn't mean you can not care about what's happening in these other communities. First of all, you should care about it because basic human decency is that we're all connected. But the reality is, every other country who's gotten into trouble, there was an outbreak in one community which led to a shutdown of the whole state. So we really, it's what I keep saying, you cannot fight this thing. You can't try to outsmart it, you can't try to outrun it. Our state will all be better off if everybody follows the rules, and the us versus them is never helpful, but it's really not helpful right now because there is no us versus them. Because if I have to shut down our economy again, it's our whole economy, and I don't want to do that. So I would urge, it's just like wearing a mask. You don't do it for yourself, you do it for your neighbor or whoever's around you. So I think that, look, it's my hope that we pull through coronavirus stronger than we went into it, more unified as a community. And I think you do that by keeping your eye focused on issues of equity, which is why we're trying really hard to get everyone tested, even if you're poor, even if you're in an inner city, even if you're an undocumented immigrant. But look, you're right.
Governor,
Last question.
obviously you talk about the importance of mask wearing right now, and we're all wearing masks, and we're all required to answer questions before we came in here. But Mayor Marty Walsh talked about extending social distancing guidelines that we're doing right now for another 6 to 8 months. Do you have any envisioning of a future where we don't have to wear masks, and these restrictions that we're in right now, we could loosen them up a little bit?
It's impossible to say. I mean, yes, I do. Of course I do. The question is when. The question is when. So if there's a more effective therapeutic, if certainly when there's a vaccine, if we were to get to a place where, you have some kind of widespread immunity in the population, but I don't see it happening in the next 5 or 6 months. I think this social distancing, hand washing, mask wearing, certainly when we reopen school, what I tried to convey in my comments today was, as we do more, go back to school, go back to college, go back to work, go back to the beach, actually we have to follow the rules even more. So I think that we should just assume it's here to stay for months and try to figure out ways to live with the new rules.